Test, test, test. All right. Let's see if we are live. We've got some exciting things to talk about today. If we can get this live going, here we go. We'll be going live in just a second for those of y'all who are on YouTube. We're waiting for Facebook to catch up. All right. Hello, everybody. It's good to see you all today. In this week in supervision, and we have a pretty interesting topic that we're talking about today. Um, and we're gonna try to run through this. This was kind of incidental. We were talking about some ethical concerns, and this was not even the plan for supervision. And we end up running into this. And what we did in this session was identified what exhibition is or exhibitionism is the conduct of it. We also identified some evidence-based therapies that would support someone who is experiencing this condition with receiving treatment. And we learned if this is a condition that would also require some type of medication treatment as well, and what type of medication treatment might be used, and the interesting psychology behind that. It was so many things that we talked about. And so I want to get into that because this is something that a lot of us may not have been exposed to. But I want to talk to in the context of a real life case. And that's what I like to bring when I talk to my supervisees, real life situations. I didn't want to expose the person who was actually involved. And so through this session, if you're a supervisor, you will get to see how I kind of put this together so that you can use some of these tactics maybe to present in supervision. A lot of us get fear about presentation and where do we get our information from. And hopefully ChatGPT, as I show you some of the things that I did as I developed the idea, what I use. But when I'm doing supervision, I use a whole lot of information from what I have studied myself, and then what we get off of real life stories and things like that. So let's go on and jump into it and see if we can get into the subject matter. And I'm going to share my screen. And this situation was a real situation. And what we're talking about here is not just what is exhibitionism or what is an exhibitionist, but we're talking about a real life situation with a clinician who was in a situation counseling someone who was an exhibitionist, and what happened, when they got exposed. How are we supposed to react in situations like that? Just think about it. If you're the clinician and you know ahead of time that you're treating someone who has this situation. You don't know what exhibitionist is. We're going to get into it in just a second. But just pretty much an exhibitionist, to sum it up, is someone who exposes their genitals to individuals. It could be random, and it's a lot to it. But what if you're the clinician and you know that this is what they do, and you end up being exposed? So this was a real life case, but this is how I want to show you a little bit. We're going to learn about this, but at the same time, we're going to see if we can use ChatGPT a little bit to help us walk through some of the questions. So how many of you all know about what an exhibitionist is? Okay. And so a lot of times our supervisees aren't aware of what an exhibitionist is, right? And so we end up having to be the ones to support and teach them with that. So I'm going to share my screen. Let me make sure I got everything removed that needs to be removed. And we're going to try to share the whole screen this time. Let's see. And so, what is an exhibitionist? And that's going to be the first question that we start with. Let me share my screen a little bit so you can see exactly what I'm doing, how I made this work. And we'll see how this goes, okay? Because ChatGPT is sometimes kind of moody, and sometimes I can't find the stuff that I want. So this is how we kind of started off supervision, okay? And so, what is an exhibitionist and a clinician's reaction to exposure? So what I did was I got ChatGPT to help me out a little bit, right? And so this is what we're gonna put. We're gonna read this off real quick, okay? Right? And so I asked ChatGPT to rephrase this into a scenario for my social work clinical supervision group of a male NBA player who was exposed, who was accused of exposing his genitals to a stranger. Include that the male was ordered by the NBA to seek counseling in the situation. While receiving counseling, he exposed he exposed the therapist. And this is basically what this saying. I just, you can just randomly put the information out there, and generally ChatGPT will put it together for you and give you more sometimes. So let's see what pops up for us here. And if this embarrasses me in front of everybody live. Okay. So and sometimes when ChatGPT does too much, you can say, hey, you might say, hey, give me a concise or summarize it, use less characters or, give me a small summary. So here it is. It says, in the scenario, a male NBA player was accused of exposing. So this is what you're presenting to the supervisees. He was exposing his genitals to a stranger, which led to the NBA ordering him to seek counseling to address his behavior during the counseling session. And so it's just replaying kind of what I just said, but in a more creative way, a way that's broken down a little bit better than me. So, how I like to do, I like to ask multiple choice. I like to ask questions about the situation. All right. And so there's going to be questions as you can see that we're going to be learning as we go. I spent about an hour and something after supervision just going through this because I'm kind of a geek and I was just getting even interested even more in some of this information. But so let's just say that you wanted to create a multiple choice question based on this scenario. You just plug it in. So what we're telling ChatGPT to do is create three multiple choice questions that include the correct answers, a detailed explanation of what the correct answer is and why the correct answer is true, and details of what the incorrect answer. So basically, what we're doing is telling ChatGPT to create us a multiple choice answer with details of not just the answer, but what's not the answer. And it's giving us three options because you may choose all of these or you may use one to present to your group. And the question is, what is an exhibitionist? Okay. All right. And we're still keeping the scenario in play here, right? We're going to go through this. And so, what is an exhibitionist? Let's see if this any of these questions look good. I'm not going to go through each of them if we land on one right away. So, what is an exhibitionist? And so, of course, you wouldn't be giving them the answer. A person who gains sexual pleasure from exposing their genitals to strangers. That's kind of getting right to it. A person who gains sexual pleasure from secretly observing others in intimate situations. A person who enjoys watching or participating in public displays of nudity or artistic purposes. A person who is interested in collecting and displaying intimate photographs. So you can use one of these or tweak it, right? And as I ask, it gives me an explanation of each of these answers why it's not so, okay? Or why it is so. This is the reason why A is correct. This is the reason why B isn't correct. Now, when you use this type of format of doing your questions, once ChatGPT gets used to it, you can just throw any question up there and it'll start giving you a multiple choice questions and just intuitively break them down in different ways. Let's see. What is characteristics of behavior? What is the characteristic behavior of someone with voyeuristic tendencies? The person derives sexual pleasure from exposing their body to strangers. The person gains sexual excitement from secretly watching others. And so in our session, it didn't do it the way I wanted it to, but let's just say they got the correct answer. You might say something like, "Well, has anybody heard of Oh, okay. So it goes into it here. What is the characteristics of someone who uh, has voyeuristic tendencies? So we're not, in this case, just going over what an exhibitionist is, but we're also identifying what voyeurism is as well. All right. Because they need to know what all of these explanations are when they're on the test. They need to know it, and they need to know it when they're assessing someone. And so here we get the definition. It's a person who gains sexual excitement from secretly watching others in intimate situations. And sometimes exhibitionist and voyeurism is confused. Okay. And so that may be something that they might need to know. This could actually be on the exam. Okay. And so here we're just learning a lot from ChatGPT. I like to ask the question, and you could get ChatGPT to help you out from the standpoint of what is exhibitionism, and I might say no, I say something like I would use an example maybe of exhibitionism, and then say, or the scenario, use the scenario and say, in this scenario, what was this an example of? A, exhibitionism; B, voyeurism; C, sadomasochism or something weird; and or C, or something. And you can get ChatGPT to help you out with that. All right. And so there's multiple ways that you can do it. So have you ever thought about what causes exhibitionism? Now, this is what I do to prepare a lot of times is use some of these techniques and interventions with ChatGPT that I'm showing you. You can use this for your group, or if you're teaching or something like that and you want to add some additional perspective when you're presenting or something. But one of the questions that people want to know is what causes exhibitionism. So a lot of times I'll put this into ChatGPT, but I also like to support it with other searches from the internet, other searches on YouTube. And I just find, I like to bring video into the sessions as well. And really, what it becomes, a lot of times I don't use any of this stuff, but it becomes a situation where you're engaging the group. Okay. And you want them to get involved, right? And so you start to see here, we got to speed up. So exhibitionism is a complex behavior with various possible causes. Important, and see, something that we went over is that how much is exhibitionism parallel to poor impulse control, and then off of that, how much is it also parallel to um, maybe someone having who has this situation. Is there sexual abuse involved? Is it more complicated than disorders to where we have issues with impulse control? And I use an example of someone who goes into the store and they have money, but then they're stealing, and then they have the impulse to do that. Like, what is that about? And what are some of the things that bring these impulses on? So we talked about that. We pulled all of this into the session, right? And so, if you're the therapist, you should already know, and you're treating this person what they're capable of. So we talked about, like, one of the questions was, and I'm kind of jumping around, what would have been the appropriate response of the clinician once they were exposed? Okay, so here it is. You have a scenario of a clinician treating someone who is known to be an exhibitionist. Okay. And so then they get upset about it, and then they go to the media because it's an NBA player. Is that ethical? And so these are some of the questions that end up being a part of the conversation. And I'm challenging the group, like, and I'm saying, hey, this is a man. Sometimes we have men in the group. Sometimes we just have women in the group, and challenging, if you were the therapist, how might this make you feel? What would be the appropriate response? What would be the ethical response? What would you do to prepare yourself for something like this? Exhibitionism, is that something that you just need to jump into, not having full experience? Is it necessary to have someone else in the clinical room with you, especially if you're a female and you might feel uncomfortable if it was a male? Like in this situation, what would you do if things got out of hand where you no longer felt comfortable about the situation? When is it appropriate to expose your client who comes to you for support to the media? These are all things that we tried to use reference to actual ethical, the ethics in ASW ethics and things like that. But we actually, we talked a good bit of this about this in detail. So it says here, we want to look at psychological factors. There's early childhood experiences, developmental delays, sexual deviance, and these are some of the things that you could study up on before you actually present and make sure that you have a good understanding of what you're presenting. And then you can narrow it down once you start to present this. So I know that in these situations, and I might ask you right now, in a situation like this, with someone who is receiving, and this is crazy. This kid that this, the real story behind this, he was new to the NBA. He was very young, and I'm not an expert on this, but I do know a little bit about, kind of impulse in situations like this, right? So he's probably got a lot going on up here and may have a strong history of trauma, but that has to be ruled out. We never know, right? But right off the bat, I'm going to examine, if I'm looking at this client, what is the stress that's in his life? Because many times, just like if you're a klepto, you know, maybe with someone who is, has, you know, uh, is a I can't say it, that participates or who is a voyeur. Some of these situations, these conditions, uh and I'm not an expert in these, but some of these impulse control situations come about when we have high stress levels. So here it is, this kid just came into the league. He may have been having significant pressures. We also went, I got to narrow this down, but we also went into trying to get into the mind of someone who has these types of behaviors. Many times they're not, their way of seeing the world and things is not quite like how we do, and that makes that makes them a risk and a danger to others. Just almost like with pedophilia, they don't see things the same way that you do, so you need to kind of have an idea of how they think if you're offering therapy, right? This is not just somebody right off the street. So I was looking at something on law, and it was an individual who had the same type of situation, right? But this was, well, it was a little different. They were known to assault, so they were a lot more aggressive. They're not just exposing themselves, but they are actually assaulting people just randomly. Okay, so there's different levels of sexual assault. Some people have low impulse control. Something's going on in there by the biology of the brain, and they don't function well in public, sometimes a danger to the public. Okay. So in this situation, there is this holding place. There's men on this side, there's women on this side. There's kind of half oval like situation where the security guard is sitting behind, and I think it's another security guard somewhere else or somewhere. But this security guard is sitting behind maybe like a 3 foot platform, and he's just sitting there. And the man comes over handcuffs and inches his way over to the woman who is asleep, and he begins to pull his pants down, and was about to sexually, or he sexually assaulted her. It was stopped before he really, was able to do anything. But I'm saying this to help you to understand the mindset and the mentality of someone who has this degree of sickness that comes to you for help. Okay, they don't function the same way as normal people. And as a therapist, you don't need to step into that environment if you don't have a good understanding of what's going on with people who experience these types of situations. It's not a normal situation. Sometimes they do need to be locked up and things like that. Sometimes they can be helped and made less of a risk to the public through treatment. Anyway, so let's get back. We're gonna wrap it up. um so so 49, 59. Oh boy. It's like I'm in session again. Okay. So what are common situations that might cause exhibitionists in a situation like this to expose themselves? Um we want to put that in. That may help you as well. Um and it can help you to understand a little bit about what might be happening here. So, a desire for shock or a reaction from others. This may be why. It may involve power and control, feelings of entitlement or superiority, escalation of behavior. Um, and it gives a number of other scenarios. It's going to give you plenty of things. Of course, you don't want to just use I want to stress this. You don't want to just use what you get off of ChatGPT. You want to fact check it. A lot of times you can ask ChatGPT, reference this in literature. And so then you proof it, right? And it's still going. I mean, you will have more than enough information when you use these tactics. And then we got into some of the DSM criteria, or you may want to get into some of the DSM criteria. You may want to even ask if you don't even, sometimes we need to find this ourselves. Where is this? They're gonna make me stop. Where is this? Well, maybe not. Where is this issue stated in the NASW ethical code, or where can we address or find out how what our conduct is supposed to be based on the NASW code of ethics? And we know that confidentiality is the key. And so this would tell you like some of the things in this scenario. It says in the scenario described where a male NBA player repeatedly exposes himself to um, a female therapist during counseling session, and the therapist ultimately reported the behaviors and sued both them and several ethical violations under the NASW code here. So I don't know how she got away with that. And I don't want to say who's the victim or not, but I'm just saying this is what I try to help to support my supervisors with understanding is that if you're going to step into the spectrum, we need to check what our exposures are. If I have trauma from sexual abuse, things like that, I need to be aware of that because something may trigger me in this environment. I might get exposed. It's probably very common that you might get exposed. And what you got to understand, is this is not exclusive to a sexual preference. So you could just think you'll be safe with another woman or safe with another man. You don't know what their preferences are, and we need to be aware of that. So we don't need to get the shock value if this happens. We need to know what we need to do in order to move forward, or we don't need to step into this arena. Right? Because then you're causing your client more damage. The client who is already emotionally distressed and distraught, has a sickness, and you're exposing them, destroying their career. Okay. This could be handled outside of the media. I'm just going to take a position on it. Um, it could be handled outside of the media. This is not what we want to do as social workers, right? Privacy and confidence violated. Commitment to our clients is violated. Respect for clients' rights and dignity, and it just doesn't give a good picture. Supervision and consultation. So get some help, get out of the room, find someone else who could do the job if you choose to. I'm just gonna leave that alone because I may be a little biased, and I was trying to get some opposing views, but everybody was pretty upset about this situation. And anyway, I needed somebody to just talk some sense, like from the clinician's point of view, like this, why that was right, what they did. What is evidence-based practice? So you could put this in the chat GPT, and you can ask your clinicians these questions, and then you have it on your mind. What is the evidence-based practice? You may bring a video to support how you might use CBT in this situation. You might have scenarios to use on how you might approach a situation when you exposed. Okay. Somebody said if the person wasn't an NBA star, would this have been carried to the media? I don't know, man. Uh, so relapse present. So we get what some options are here for treatment. And a lot of times I like to bring scenarios of this through use of video. And this was interesting here. Have you ever thought about medications treatments that are used? And this is going into that. But if you wanted to ask ChatGPT, of course, we want to fact check everything. Fact check everything. ChatGPT can be used as a guide. Okay, a guide to let you know. Let me check. and see if I want to add this information. Selective serotonin reuptake inhibitors. So SSRIs. Have you ever thought that SSRIs are used in this situation? How does that happen? What does the SSRI do to support someone who may have issues with exposing themselves inappropriately to others? Okay? Wouldn't think some of us, right? But this is a lot of times supervisees may not notice. Some of them will add more perspective than what you know, and you just got to sit back and just take it in and add what perspectives. Don't get insecure. Add what perspectives they have to share. That's why you want to make sure you have a fundamental understanding before you come with each topic, but you can get a lot of this with the use of some of this guidance here. Okay, so SSRIs. And so how does that help? How it helps? It reduces sexual compulsions. SSRIs can help to reduce the repetitive compulsive behaviors associated with exhibitionism, such as the urge to expose oneself in public. It improves the mood and reduces anxiety. See, this is what I'm hitting on. This is what I'm talking about. Like, I'm not saying I would take this client because this is not my area of expertise, but I'm just saying fictionally, if this was my case, I'm looking at his stress. He just moved into the NBA. That's not gonna be 100% the treatment and the resolution. But how do I know if this is relative? We talk about the FID, frequency, intensity, and duration. How frequent have you been doing this prior to the NBA? Well, you might have been doing it a lot because, you were just in high school and exposed there. Excuse me for exposed as far as being a star in the NBA. I mean, in the high school. So, but it may have increased once we got that contract. We're getting paid now. So we want to follow frequency, intensity, and duration, learn about that. But they're saying sometimes anxiety can be reduced with these types of treatments. All right, so you learn a lot and just really kind of get into it. But I'm gonna stop here. I've gone really long. Uh, and so I'm hoping that this can be of support to you and hoping that you learned a little bit about um what to do in a situation if you have to work with a client and this occurs. One thing that we didn't mention, document. Okay. We had a few people that were in home health, and if you're in a nursing home, you get this all the time. So I'm just kind of bothered by this. Anybody, some of y'all worked in a nursing home, right? If you work in a nursing home, you're getting exposures all the time as the therapist or as the social worker, the clinical social worker, whatever social worker you are in that nursing home. That's what you're getting. And no, we're not going to the media. Okay, and that's by alert and oriented times three individuals. Go to the VA and see what happened. My wife used to work there, so it was a lot going on. Okay, so because my wife is attractive. All right. Anyway, so treatment, so documentation, uh set boundaries with the client. This is one of my supervisees suggestions. Talk to your supervisor if something like this comes up and things like that. So it's a number of things. I better stop here. But I hope this has been helpful, not just for you understanding and getting an understanding of what exhibition is exhibitionism is, but also kind of understanding what you would do ethically and how you might need to be prepared as a clinician before you even step into this therapeutic environment. And so that we don't cause further pain and that we understand in detail what we're working with. I hope to see you all again on next week. I didn't mention that we do have let me share the screen real quick. We do have a few free trainings. We have a free training coming up that I would like to share with you. And we have none other than LB. LB, she's so awesome. Will be speaking at this particular training if I could find it. Here we go. Um, and the title of this training is Making Sense. Making Sense. And I hope that you all can attend. This is free to anyone. And we've got to get this corrected here. But this training is free. And it's making sense, understanding the importance of financial social work. And that's going to be on Tuesday, February 18th. So that's coming up next week. And we've got LB Brown, and she's an awesome speaker. Let me tell you, you want to attend this. If you're looking for supervisor training, we've got one live for you on March 24th and 25th. Come check us out. Good way to bring some income in on the side, or maybe full time for some of you all. Okay. And then we have the DSM-5 TR training. And what I want to say too about the supervisor training is that there are some requirements, and we're going to talk a little bit more of that, requirements as far as your experience in the field post license that are required on each level before you take it. So, if, for example, if you're a LICS, looking to be a LICSW, you have to have 2 years of experience post license. Okay, post license experience to be a clinical supervisor. For LMSW, you have to have 3 years post license experience. Okay, to qualify, and for LBSW, 5. So it's 2, 3, 5. Okay. And then lastly, the DSM-5 TR training. Check that out. If you, this is a requirement for all LICSWs to take a DSM-5 TR comprehensive training from someone. Hope you can check us out. This one is on demand. All right, let's go. Y'all take care. All right, bye bye.